Good afternoon, and thank you very much for your kind invitation, Professor El-Sawawi. I am Eduardo Cazap, medical oncologist based in Buenos Aires, Argentina. I am very much interested in the point that you have raised about options or alternatives for prioritization or normatization of guidelines regarding options, alternatives for cancer patients in different parts of the world. You have mentioned some ones like choosing wisely, common sense oncology, or the case of stratified guidelines developed by Professor Ben Anderson. And I would like to share with you and the audience some of the basic points that for me are critical in this open discussion. I think that all type of recommendations, committee suggestion, prioritizations are documents, are norms, are guidelines. And that could or could not be followed by doctors. But I think that in most of the countries of the world and in most healthcare services and systems, the problem is not today based in guidelines. The problem today is based in access to care, continuity of care, of course, affordability of care, and the completion of the indicated treatment on time and following the best available guidance. So, saying this, I must underline the issue of doing more research in different healthcare systems in different countries about what happens after the medical indication or at the same time of the medical indication. Questions as, for example, is the doctor following some recommendation? Okay. If the doctor follows a recommendation, this following question is the patient following the recommendation? Is the system supporting the patient for the recommendation to be implemented on time and properly? Has the patient completed the treatment? And then, if we answer those questions, we will have a better idea not only about the recommendations, about the use in real time and real life of the recommendations, and with that, we can then plan estimations of results, monitoring, survival, curability, with a concrete and strong base. If not, in my view, until today we are having a theoretical discussion about all these options. Why? Because there are not, in general, evaluations about the how doctors are really doing the things in compliance with certain guidelines. We are not evaluating the continuity and the follow-up of patients at the healthcare systems and the necessary environment. I am not talking about money. I am not talking about what are or what is planned in the guideline. I am speaking about the evaluation of the compliance of such recommendations, the recommendation that You can choose any of them, choosing wisely, common sense, ASCO, ESMO, stratified guidelines, whatever. But we need to analyze how doctors react in the daily practice with guidelines, how patients are following or not the guidelines timely and properly, and how healthcare systems are really responding to this crucial need. So in summary, I recommend to increment the number of studies about the compliance of doctors with guidelines, the follow-up and monitoring of patients during the health system's continuity, and then to plan the best strategy in order to obtain the results that are more logical, efficient, useful, and realistic recommendations for different countries of the world. Thank you very much for your attention.